Minister Dr. Joe Phaahla and other government officials have been visiting Kanana in Hammanskraal this afternoon. The area is the epicenter of the cholera outbreak. Phaahla's visit is to intensify efforts to respond to the rising numbers of laboratory-confirmed cases of cholera and the mortality rate. At least 22 people have died so far in the country, 21 of them in Hammanskraal alone. Pule Letshwiti-Jones is there. He's joining us this hour to give us an update about what the minister had to say there on those grounds where we see those tents that have been set up to assist to treat cholera, people who are sick with cholera there in Hammanskraal, and also at the Jubilee Hospital, we understand, Pule, a little bit earlier. So, Dr. Phaahla, what did he tell you?
Definitely. Good afternoon, Pratan. And as far as you understand, just behind me, I'm just going to ask my colleague Percy Sibia to zoom in so he can show you. These are some of the medical facilities which have been temporarily built in the epicenter, we understand, of Hammanskraal, which is Kanana. This is the epicenter of the cholera outbreak. And this is where most of the medical practitioners will be operating from. We understand that most of the community members who are feeling like they have cholera-like symptoms have been urged to report to these symptoms. Now, earlier in the week, you'd remember the Minister of Water and Sanitation, Deputy Minister rather of Water and Sanitation, David Mahlobo, had said that they would intervene by instituting command centers and also erecting temporary medical facilities in some of the affected areas. And as you can see, this is where most of the community members will be treated. It hasn't been complete. We understand some of the medical resources will be delivered from tomorrow. And this is where also some of the medical practitioners will be operating from. Next to it is a water tank. This also is a temporary solution of ensuring the distribution of clean water to some of the residents, clean drinkable water. Earlier on, we were in a briefing where the Tshwane Mayor, Celia Brink, was part of, and of course the Department of Water and Sanitation Minister, Senzo Mkhunu, was part of, in which he said that that's what they could only do for now to ensure water tankers are delivering water across some of these affected areas. But their next step will be to knock on the National Treasury's door to get funding. The city of Tshwane needs just about 2.5 billion to complete the Rooiwal water project, but it seems as though they may need more than that. And we will be hearing from the ministry next week as to how fruitful were those talks. And of course, we understand that the Rooiwal water plant is not, a project that can be completed overnight. It may take years as well. So for now, it means that government and the municipality will be relying on the efficiency of these water tankers to distribute water across these affected areas in Hammanskraal. But let's just take a listen to what the health minister had to say earlier on, Joe Phaahla, regarding those numbers there of those who've died from the cholera outbreak, of course, saying that 4 of the people who've died, the results came from the lab, and that the rest of those who died as a result of the cholera deadly outbreak presented symptoms which were, of course, put together as a result of tests which were collected from the hospitals in which these people died. Let's take a listen to what Dr. Phaahla had to say.
The death toll currently stands at 22, and out of the 22, so the 4 he was referring to, it's out of those who have died. The number has already passed just over 200, those who are presented to the health facilities with diarrhea disease. And out of those, 45 have tested positive for the cholera. 45 have tested positive. The rest have been treated for diarrhea disease, which is not confirmed as to whether it is cholera. Of those who died, only 4 out of the 21 is the ones who had confirmation. But in total, out of the bigger number of people who had diarrhea, even those some who have been discharged, out of those 45 had tested positive for the actual cholera bacteria.
Yeah, the death toll in the country, Pule, of cholera due to the cholera outbreak is 22 people, 21 of them there in Hammanskraal. But there's dozens more who've been admitted to hospitals. I mean, some 200 people on the ground there. Are you getting the sense that those who have managed to access Jubilee hospitals and coming to that facility there in Kanana are getting the assistance they require? They're being stabilized and hydrated properly?
Well, you know, Bredan, government in the municipality of Tshwane has been scrambling for ideas over the past couple of days, particularly with the news of the cholera outbreak in Hammanskraal. And therefore, by day, we've been seeing the progression to capitalize and ensure that there's more resources, more nurses, more epidemiologists who are at some of these district hospitals as well, to ensure that they can assist the patients. Over time, we've heard from some of the community members on the ground who were at the Jubilee hospital to say that they were getting that assistance, but more nurses are needed, more doctors are needed to ensure that they treat the influx of the patients who are coming in presenting some of these cholera symptoms. And therefore, this is the reason why government says that they have erected some of these temporary medical facilities to ensure that not everyone will have to come to the Jubilee District Hospital if they urgently need assistance, but that they can come to these facilities here where they can get that assistance. And as you can see on screen, these are some of the medical practitioners who will be installing, Bredan, the equipment that will be needed to treat some of the patients here. And like I said earlier, the Minister of Health, Dr. Phaahla, saying Kanana, of course, is the epicenter. This is where most of the people who were part of the cholera outbreak tested positive for. And this is the area which is now being merely focused on for now. We understand that most of the resources will then be taken to other areas which are affected and which continue to bear the brunt of this cholera outbreak. Tomorrow, the Ministry of Health will be here again to monitor how the situation is here. We also understand that the SAPS in the province and the Commissioner, Mr. Mawela, will be on board in terms of protecting and ensuring that patients are safe here and ensure that the resources here are protected and are prevented away from theft as well. So it seems as though for now it's all hands on deck, Bredan. Everyone's coming in to try and assist, and we'll be waiting to hear from the Tshwane municipality and of course the water and sanitation departments from next week as to whether they have secured the funding from Treasury to ensure that they can resolve that issue and completion of the Rooiwal water plant project, which of course would be responsible for the distribution of clean water in the area of Hammanskraal.
Yeah, hopefully whatever money they get from National Treasury this time around will resolve the problem. Pule, you may not be aware, a few years ago, recently, they were given 300 million rand to fix Rooiwal, but nothing happened. Thank you very much. Pule Letshwiti-Jones there in Kanana in Hammanskraal, just giving us a wrap-up of the day after a visit there by several government officials like the Health Minister, Dr. Joe Phaahla, and earlier we saw the Mayor of Tshwane, Sile Brink, together with the Minister, the National Minister of Water and Sanitation, Senzo Mchunu, all of them visiting Hammanskraal today.